Welcome to the WPS Military and Veterans Health webinar on Skilled Nursing Facility Guidelines. In this webinar, we will discuss skilled nursing facility guidelines that include coverage and benefits, certifications and agreements, prior authorization forms and procedures, and billing requirements. A skilled nursing facility, or SNF, provides skilled nursing rehabilitation or other care, including medication administration. SNFs are not nursing homes or intermediate facilities. The need for services provided by SNFs is common for TRICARE for Life, or TFL, beneficiaries, and there is coverage available for the services. It is important to note the difference between SNF care and the services they provide as compared to custodial care, long-term care, and nursing homes. TRICARE for Life does not cover custodial care, long-term care, or nursing homes. In this webinar, we will be providing you with helpful information on coverage, guidelines, billing, and authorization requirements. Our goal is to help you better understand expectations and policies under the TRICARE for Life program and provide the highest level of customer service. It is our intent to provide as much support and education as necessary to fulfill our promise to you and consistently provide benefits under the TFL program. If you need further clarification on any of the information provided, please contact us. Skilled nursing facilities provide a high level of medical care that includes nursing, rehabilitation, and other care, including medications. Skilled nursing facilities are not nursing homes or intermediate facilities. Beneficiaries may qualify if they are treated in a hospital for at least 3 consecutive days, not including the day of discharge, and they enter the skilled nursing facility within 30 days of the hospital discharge. There is no day limit to skilled nursing care as long as the care is medically necessary. To be medically necessary means it is appropriate, reasonable, and adequate for your condition. Prior authorization is not required except for active duty service members and Medicare eligible beneficiaries after the first 100 days. Covered skilled nursing services include a semi-private room, regular nursing services, meals, including special diets, physical, occupational, and speech therapy, drugs provided by the facility, and medical supplies and appliances. Skilled nursing services are covered only in the United States, District of Columbia, and U.S. territories. Medicare will cover 100% of skilled nursing costs for days 1 through 20. For days 21 through 100, Medicare covers all costs except for the required Medicare copayment. TRICARE for Life covers the copayment. After day 100, TRICARE for Life will become the primary payer for skilled nursing care, and the patient is responsible for the TFL cost share. A new benefit period starts with Medicare once the patient has not received any inpatient hospital or skilled nursing facility care for 60 consecutive days. Skilled nursing facility providers are required to sign a skilled nursing facility prospective payment system, or PPS agreement, also known as the Skilled Nursing Facility Provider Participation Agreement. Providers must sign and submit this form to TFL in order to be considered an authorized TFL provider. Claims from skilled nursing facilities that do not have this agreement on file will be denied. Please make sure all your W-9 form and tax information are accurate. This includes your TRICARE SNF participation agreement. Undocumented changes can affect processing. Some examples include changes to the facility or company name or new facility or company name, changes to the facility's physical address or a new facility physical address due to construction or acquisition. Company was purchased or became part of a group under a different name. changes in billing or payment address, and relocation due to natural disasters such as hurricanes, earthquakes, wildfires, floods, or tornadoes. Complete provider forms and instructions are available on the TRICAREFORYOU.com provider portal. Here are samples of the W-9 and the Skilled Nursing Facility Participation Agreement with TRICARE. Again, you can find complete provider forms and instructions in the Forms section of the provider portal on TRICAREFORYOU.com. TRICARE for Life has adopted Medicare's Skilled Nursing Facility Prospective Payment System payment method and reimbursement rates, consolidated billing requirements, and Medicare minimum data set assessment requirements effective with all SNF admissions occurring on or after August 1, 2003. Bill type 21X must be submitted on the claim form, along with revenue code 0022 and the corresponding HIPS codes for the charges being billed. During Medicare's 100-day benefit period, SNFs will use the same HIPS codes for TFL patients as those used under Medicare. For TFL beneficiaries, SNFs will use the appropriate PDPM that makes up the HIPS code after the 100th day in the benefit period. Do you need an authorization? Pre-authorization review is only required for TRICARE for Life beneficiaries when TRICARE for Life is the primary payer for the specific services listed below. There are several services, so to save time rather than reading each one individually, we encourage you to visit the Skilled Nursing Facility Guidelines on TRICAREFORYOU.com, then go into the Prior Authorization, Concurrent Authorization section. There is a link to the entire list. You can find the prior authorization forms for these services in the Forms section. There are a few ways you can submit your authorization requests. Online. The most efficient and reliable is through the TRICAREFORYOU.com portal. The website is active 24/7, 365. These transmissions go directly into the system and are accessed by the SNF nurses. Fax. The next fastest option would be via fax to 608-301-3226. It takes at least 24 hours to get faxes into our system. Mail. The postal mail or paid delivery to the post office box or even to our physical address is actually more costly to you. All mail and deliveries must first go to the general mailroom to be screened, classified, and distributed through the entire company, and may take multiple days. Please put the date it was sent and the date it was due to arrive on the authorization request form. Online web portal submission is highly recommended. The authorization nurses have up to 5 business days to complete a review. Reviews are done in the order they are received. The provider will receive a decision via fax, secure email, or postal letter. What is required and needed for a skilled nursing authorization request? TRICARE for Life requires pre-authorization for skilled nursing facility care once TFL becomes the primary payer. By law, TFL is the last payer after all other insurance or benefit plans, including Medicare. To obtain SNF pre-authorization, please complete the Skilled Nursing Facility Authorization Form along with the following information: the most recent hospital history and physical, or H&P, current physician orders, if admit or readmit, physician admitting orders, and documentation of skilled care. TRICARE for Life follows Medicare Part A guidelines for skilled care, excluding established feeding tubes or enteral feedings. To more efficiently process your pre-authorization request, avoid processing delays, and eliminate the need for retrospective reviews and payment reduction, we kindly ask that you only submit the required information listed. We will complete your authorization request within 5 business days from the date of receipt. How do you find out if the authorization is approved? You will receive a confirmation letter via fax once the authorization has been completed. If you do not have a working fax, you will receive a secure email. It will also be mailed to you and to the beneficiary. 100% of all authorizations will be completed within 5 business days. How long will the authorization be good for? This can vary depending on the patient's needs, but an authorization will only be granted for up to a maximum of 30 days. If additional care is needed beyond the 30 days, a new authorization will need to be requested. How do you get an authorization to admit? TRICARE for Life will never give an authorization to admit. We follow Medicare aid guidelines for skilled care, excluding established feeding tubes or enteral feedings. Admit or transfer the resident and initiate skilled care immediately. Provide documentation of the skilled care that he or she is actively receiving in your facility for an authorization. Do not delay initiating skilled care waiting for the authorization. Retroactive authorizations are not provided. If the service has been performed greater than 5 business days ago, the provider will need to submit a claim with supporting skilled care documentation for a review to the claims department via the website or via fax at 608-301-2114 or 608-301-3100. There will be a payment reduction of 10% for not having an authorization. Do you have to do anything if skilled care ends? Visit the website and obtain a Notice of Non-Coverage letter. Provide it to the resident or power of attorney for a signature and submit it with the request form as a cover sheet. How do you get a denial letter? Submit the TRICARE for Life Notice of Non-Coverage letter and you will receive instructions on what to submit to get a formal denial letter. Do you have appeal rights on unfavorable authorization determinations? The answer is yes. You will have formal appeal rights on denied authorizations, and those appeals will be handled through the appeals department. An appeal request can be mailed to WPS SNF Appeals, 1707 West Broadway, Madison, Wisconsin, 53713. They can be faxed to 608-301-3226. Billing charges. In addition to the 0022 revenue codes and corresponding HIPS codes, all SNF claims must contain a line item listing by revenue code of all services rendered to the beneficiary during the dates of service on the claim and the billed amount for each. This line item listing should include a room rate charge for the number of bed days equal to the date span of services billed. MDS assessments. Skilled nursing facilities will be responsible for performing the resident assessment using the Medicare MDS assessment form and guidelines for determining the medical necessity of services. SNFs shall use the default HIPS rate code of ZZZZZ on the claim in the case of an off-schedule or late patient assessment or in the case of no patient assessment at all. Other health insurance. Please visit the SNF Guidelines section on our portal, open the Other Health Insurance packet, and then click the link to How Does TRICARE for Life Work with OHI? There are several OHI FAQs there as well. To determine if Medicare covers a specific service or benefit, visit www.medicare.gov or call 1-800-633-4227. To determine if TFL covers the service or benefit, visit the Defense Health Agency website www.tricare.mil. How Medicare coordinates with other health insurance depends on whether the OHI is based on current employment. In any case, TRICARE for Life is the last payer. If the patient has OHI that is not based on their or a family member's current employment, Medicare pays first, the OHI pays second, and TFL pays last. Generally, if the patient has an employer-sponsored health plan based on current employment, that health plan pays first, Medicare pays second, and TFL pays last. If there are fewer than 20 employees in the employer-sponsored plan, Medicare pays first, the employer pays second, and TFL pays last. Please note, TFL pays after most insurance plans, with the exception of Medicaid, TRICARE supplements, the Indian Health Service, and other programs and plans as identified by the Defense Health Agency. For more information on how TFL works with OHI, please visit the Defense Health Agency site www.tricare.mil. Leave of absence or transfer to acute care special notice. We cannot process a claim with a more than 3-day leave of absence. Current span code 74 must be present on the claim form box 35 or 36. Claims not meeting these requirements will be returned. Any leave of absence bed days must be billed with the applicable 18X revenue code. If a SNF resident returns to the SNF following a temporary absence due to hospitalization or therapeutic leave, it will be considered a readmission and any leave of absence days will be disallowed. As under Medicare, neither TFL nor the patient are responsible for any charges related to leave of absence days. When documenting Medicare and OHI exhaustion of benefits, for Medicare, occurrence code A3 and the date of exhaust can only be accepted on the electronic crossover claims from Medicare. Please note, TRICARE for Life can only receive crossover claims from Medicare. We cannot accept electronic crossovers from a Medicare supplement. Other acceptable forms of documentation of exhaustion of benefits are explanations of benefits from Medicare showing exhaustion or from the OHI showing exhaustion, or correspondence from CMS or the secondary OHI. For correspondence documentation from the OHI, the exhaustion letter and information must be on the OHI company's letterhead, and the letter must specify that the benefit will no longer pay. It is very important you do not change the admission date to the Medicare exhaust date unless the patient was discharged. If billing Medicare, enter code 21 to demand Medicare deny the claim. TRICARE for Life will also deny. Medicare code 272, not covered due to provider information. Remember, Medicare is the only primary that can electronically cross the claim over to TRICARE for Life, as they are both federal government benefit programs. If the patient is on the Medicare crossover, those claims usually reach us and are processing before your online, faxed, or mailed claims. If we receive multiple claims for the same charges or changes, claims may be denied or returned due to discrepancies between multiple claims or duplicate claim appearances. Signature requirements. UB04 claim forms submitted with the corresponding Medicare EOBs do not require a signature by the facility's authorized representative. However, once Medicare benefits have exhausted, and if no Medicare EOB is attached to the claim form, then an authorized representative must sign the claim form in or around Form Locator or Box 80. A computer-generated name, Stamped, handwritten, or digital signature and initials are all acceptable. Signature on file is not acceptable for a valid provider signature. Common claim return or denial reasons include missing, invalid, or incomplete type of bill code, admission date, discharge date, occurrence code and date, revenue code 022 and 5-digit HIPS code, revenue code 022 with a billed amount but no line item listing of all services rendered, or diagnosis codes. Other common reasons for claim returns or denials are no Medicare EOB or Medicare supplemental EOB showing full processing details, no documentation of Medicare or medical supplement exhaustion date, illegible EOBs or unsigned claim forms, missing or incomplete medical documentation or records, date span billed and number of units for HIPS codes and room charges not agreeing, claim form is missing the occurrence code 70 and the required 3-day inpatient qualifying hospital stay, or claims submitted to TRICARE for Life as a primary payer which have incorrect codes such as PDPM when we need RUG 3 or RUG 3 when we need PDPM will be returned for corrections. This concludes our presentation. Thank you for watching. We hope you enjoyed this presentation and found it useful. This presentation will be added to the tutorial or webinar section of our portal in a few days. Please follow and like our social media pages on Facebook, Twitter, and YouTube at the addresses provided. You can also follow by clicking the social media icons in the lower right corner of our portal. We will now have a question and answer period. Please do not disclose any HIPAA-involved or Protected Health Information, PHI, in this public webinar.